Hello, everyone. Happy Thursday, and welcome to BioVigil's webinar series. Today's webinar is Prioritizing Patient Safety, our hands-on approach to improving patient care. I'm your host, Amanda Holden-Sinisi. I'd like to share a few housekeeping items with you before we get started with today's presentation. First of all, your line is already muted, so you don't have to worry about muting yourself. This webinar is absolutely for you, so we do encourage you to ask questions using the QA message box at any time during the presentation, and we'll do best to answer all of the questions at the end of the presentation. BioVigil's webinars feature key opinion leaders who are making a significant impact with patient safety and experience in hospitals. Our speakers share data insights and best practices that have made their organizations best in class in the culture of staff and patient safety and driving exceptional patient experiences. We are honored to have Dayle Bower, RN, BSN, CIC as our speaker today. Dayle is an infection preventionist at United Health Services Hospitals in Binghamton, New York. She served as a registered nurse at UHS for the last 6 years, 3 years in medical surgical care, and 3 years as an infection preventionist. Dayle earned an Associates of Nursing degree from Broome Community College and a Bachelor's in Nursing from Binghamton University. This fall, Dayle begins a Master of Public Health program. She's a member of the Association of Professionals in Infection Control and Epidemiology and approaches life with a love for constant learning. Welcome, Dayle.
Thank you so much for that introduction, Amanda. All right, I'll begin by telling you a little bit about our hospital on our next slide here. So Wilson is a 280-bed medical facility with 24-hour trauma, stroke, and a chest pain center. We're a regional referral center for high-level medical and surgical services such as cardiac surgery, neurosurgery, oncology, emergency care, maternity, and high-risk obstetrics. We have a level 3 NICU, AM-Surg, diabetes and blood disorders treatment, physical therapy and rehab, and we train physicians through a long-standing and highly respected medical residency program. And about 5 miles away, we have our second hospital campus. It's Binghamton General Hospital, which is 220 beds. We also have 24-hour emergency care there, and we operate major regional programs such as orthopedic surgery, bariatric care, wound care, physical therapy and rehabilitation. And we also have our chemical dependency treatment and behavioral health programs there. We also have sleep center and our GI lab. So let me set our setting here for you. We're located in Broome County. We have a population of about 200,000 people according to the last census. And 40% of our community is actually age 65 or older. But our small city does have our own claims to fame here. We're home of Binghamton University, which is recently and consistently recognized as one of the top 20 universities in the country. We are the birthplace of IBM and the Twilight Zone, or the carousel capital of the world. And you may recognize one of our famous residents, April the giraffe. She's the famous mother whose pregnancy captivated 14 million viewers on YouTube. So that's a little bit about our setting. All right, so we brought in BioVigil really as a patient safety measure. So patient safety is the absence of preventable harm. And obviously, healthcare acquired infections can be preventable. So we have a responsibility to emphasize safety at every step of the way. Risk managers in the room have undoubtedly heard of the Swiss cheese model. And this is a way to describe an event where all the holes line up just so, allowing for harm to occur. So preventing HAIs means plugging the holes in all these slices of cheese. So the National Patient Safety Foundation issued its Free from Harm report in 2015, acknowledging these and other challenges for the safety field. And the report made 8 key recommendations to ensure continued progress in the safety field. And these are ensuring that leaders establish and sustain a safety culture, create centralized and coordinated oversight of patient safety, create a common set of safety metrics that reflect meaningful outcomes, increase funding for research in patient safety and implementation science, address safety across the entire care continuum, support the healthcare workforce, partner with patients and families for the safest care, and ensure that technology is safe and optimized to improve patient safety. So these were some of the items we used to help support our decision to go live with BioVigil. So hand hygiene is very important, and it's not just the infection preventionists talking about it, it's everybody. It's the CDC, it's the Joint Commission, it's the World Health Organization. So these are some of their direct quotes. And I like to talk about the history of hand hygiene here. So in 1847, Dr. Ignaz Semmelweis in Vienna recommended the use of hygienic measures such as physician hand hygiene before assisting delivery. This resulted in decreased infections, and the maternal mortality rate dropped dramatically, and it remained low for years. Despite this, Dr. S. met serious resistance from his medical colleagues and was ultimately dismissed from the Vienna hospital system. 3 obstetricians signed referrals committing him to a mental asylum. His theory that good hand washing was not accepted until after his death. So this intervention by Semmelweis represents the first evidence indicating that cleansing hands with an antiseptic agent between patients may reduce healthcare-associated transmission of disease. So after 150 years, why is this still a problem? Excuses from healthcare workers range from being too busy to the washing solution and alcohol rubs drying out their hands, constantly have to carry equipment which makes it difficult to wash, to engineering obstacles like hand washing facilities being inconveniently located. And others simply say they forget. So in 1975 and 1985, the CDC issued formal recommendations saying when hands should be washed. And in 1995, APIC guidelines included very detailed discussions of how alcohol-based hand sanitizer was more effective than hand washing in sinks in some cases. And now in more current times, and as of May 2017, studies show that on average, healthcare providers clean their hands less than half of the times they should. So are you thinking about your own hospital's hand hygiene rates right now? How do you compare? This contributes to the spread of healthcare-associated infections that affect 1 in 25 hospital patients on any given day. So let's talk about how we observed hand hygiene before BioVigil. We had a direct observation method. One of the 5 infection preventionists in our office would take a handheld cell phone or iPod, and we'd go out on the units, and we'd watch, and we'd observe. So it was not a very accurate measurement. There's an effect called the Hawthorne effect, where staff change their behavior when they're being watched. So after a while, they'd come to get to know us. They'd see, oh, the infection preventionist is on the floor again, and they'd wash their hands pretty theatrically sometimes, just to make sure that we got their observation. So it was not a very accurate way of measuring. It did have pros and cons we discussed back in our office. It did get us out on the unit and interacting with staff, and then we were able to provide on-the-spot coaching and just educate. Sometimes staff didn't know that even if they were just going into the soiled utility room for just a moment, counted as getting contaminated and needed hand washing afterwards. But it was very, very time consuming. We aimed to collect 30 observations per month per unit, and we have about 22 inpatient units. So doing the math, that equals quite a lot. And we mostly observed the day shift. Sometimes we would catch the 6 a.m. or 3 p.m. change of shift rounds, but that doesn't represent a good section of the shift. And another con was we were not always sure of what the job roles were. It's very hard to distinguish nursing assistants and nurses out on the units if you don't know them personally, or if somebody's not in scrubs. Are they a physician? Is it a social worker? So it's not always easy to tell. And then we give that report to a manager, and it's not very actionable for them. So we give them the report card, and it showed their hand hygiene would be maybe 70%. But what could they really do about that? Or what if it was a 100% hand hygiene compliance rate or a 30% rate? That's not really anything the managers could act on if they weren't seeing it. Okay, so we did decide that something needed to be done. We held a series of focus groups These were located at both hospital sites, and we would have people come in and just brainstorm. We asked them everything about hand hygiene. So every participant rated hand hygiene as a 5 out of 5 on a scale of importance. And as a group, they could name all 5 of the World Health Organization moments. And then we asked them, well, what do you think our compliance rate is? Nobody said 100%. It was more like 50%. And then we asked them what prevents them from washing their hands. And we got every kind of answer. Forgetting, the sanitizer not being in the best location. And we also found out that staff, most of the time, they were too intimidated to confront one another. It's very hard to call out one of your coworkers saying, hey, I didn't see you wash your hands coming into the room. And even harder so for maybe a new staff member to call out a physician and say, I did not see you wash your hands. Why don't you hit the sanitizer? And staff were often not held accountable. So the prospect of electronic hand hygiene monitoring systems did come up. A lot of people in our focus group said they had seen them at other hospitals. And so we decided maybe we could look into it. It might be something that we could attain. So we did look into a couple different companies. I think we took some field trips. This was before I was involved in our office here. Our former manager and a former performance improvement staff member took some field trips to some other local hospitals and observed a couple different types of electronic systems and weighed the pros and cons. And so we decided to go with BioVigil. It seemed to be, it had fewer loopholes, I should say, than some of the other systems we looked at. So BioVigil supported us the whole way. Starting in July 2017, we trialed BioVigil on 3 different hospital inpatient units. And we chose units where the managers were very open to change. That was a really important thing because this was a major implementation. Even on a small scale trial, it did take a lot of input from the managers, a lot of openness from the staff, and we picked units that were very different layouts too. We wanted to see how this worked in all the different types of semi-private rooms and all the nooks and crannies that we have in some of these older buildings. In July 2018, we fully implemented it in all of our units. We were satisfied with the trial. We loved the data we were seeing. So we went from just those 3 units and added 13 more for a total of 16 units. And we did this all in 10 days. So we trained thousands of new employees with the help of our nursing education department, and we had BioVigil support the whole time. So we actually began this trial long before the Joint Commission announced that new zero tolerance policy for poor hand hygiene. So we were pretty confident in our hand hygiene rates. So as of last week, we have about 2,245 registered BioVigil users in our system. So we did give a lot of notice to staff. Communication was one of our biggest obstacles. We had to keep the excitement up. So we partnered with our community relations department. We made signs, we went to the units, and we really wanted to get the message out. We wanted to make sure other staff knew what this strange new light up device was, and more importantly, we wanted to make sure our patients knew what it was and what it was for. So we used some of the materials that BioVigil gave us, and we kind of tailored it to be our own. So this talks about what the messaging means, how it reminds staff to use the hand sanitizer when they're entering and exiting. It reassures staff and coworkers that I didn't just come from the room next door without cleaning my hands. My badge is green. And it records entries and exits, hours worn, compliance, cross-contamination. But most importantly, we had to emphasize this strongly to staff. There's no GPS. We're not tracking any personal information. We did not put it in staff restroom areas, so we don't know how long you're taking on breaks. And these kind of things are really important to communicate to staff. So managers were able to get weekly and on-demand automatic reports and custom reports of any metrics they could want. And I want to point out one little detail on this thing. The last line on this poster said our goal is 100% hand hygiene compliance. We put a lot of thought into that line. We said, do we want our goal to be 80%? Do we want it to be 90%? Even 96%? And we said, no, the messaging we want to get across is our goal. Our ultimate goal is 100% hand hygiene compliance. So internally, we try to aim for 96 or higher because we recognize there are emergencies or extraneous situations, but our goal is 100% during the times when it matters. All right, so this was a very large scope project. These are all the different departments that were involved. So I just want to point out a couple star players here. Patient transportation turned out to be one of our most important departments. They do a lot of education to the staff members. When they're waiting in an elevator, they can talk about what it is, and they're the ones going unit to unit, so we see them in the halls quite often wearing the badges. Our radiology department was not on our original plan to be a part of this. We didn't really expect them to be going into the rooms as much. We often send patients down to them for procedures, but when they heard what we were doing, they wanted in on it. So we quickly were able to adapt and incorporate them into it. We got a list of their staff, gave them all access, so they turned out to be one of our strong partners too. Physicians, as is often the case, they need extra support. So, you know, doctors by nature, they're researchers, so they want more data. They want all the facts. So it's been a little more of a struggle to get them along. We have gotten our medical students and residents wearing it. They're the ones that are really setting an example, and the nursing staff really feels very supported when they know that there's more providers who are wearing them, or some. So there is no single strategy more effective than proper hand hygiene in reducing the spread of HAIs, and it is multidisciplinary. So all of these departments you see here, they wear the badges. It's environmental services, it's the dietary staff delivering lunch trays, and it can be found on all of our inpatient units. Even our critical care units, our ICU has it, and our emergency department has it. So it works there too. Ambulatory surgery, and we now have it in labor delivery and our transitional care unit as well. There are some units we decided not to implement it in. Our NICU and our newborn nursery, they're just a little harder with the layout. Those bassinets, they're on wheels. They don't really have a set location where they go, so it would be a little more difficult to implement there. We decided not to use it in our psychiatric mental health care units or the substance rehab unit. And we didn't use the badges for our engineer department, our outpatient clinics, and non-patient care areas such as patient records, the cafeteria, hallway. And there are some units where they don't wear the badges, but they've been a huge, important part of the team. That would be information services, our nursing education and research department, security, human resources, community relations, and performance improvement. These are all departments that are a crucial part, so don't leave them out when you're planning. Okay, so next I'd like to talk about some of the outcomes we've had. So we definitely improved hand hygiene. Our rates ranged from an average of, it varied every month, but we'll say 60%, and we have been consistently above 96% ever since the trial started back on the original 3 units. We have not dipped below that 96% hand hygiene compliance, and that is with over 1 million hand hygiene opportunity observations per month. So hand hygiene, it is a patient safety issue. And it's also a patient satisfaction and patient confidence issue. And it's the #1 step in any HAI prevention bundle. So by implementing this electronic monitoring system, we've increased our hand hygiene compliance and regularly surpass our initial goal. We gain the ability to monitor day, evening, and night shifts, so no one's being left out anymore. And now we can use this individual data to coach employees on hand hygiene opportunities. So we get names and we get times, and we can help walk them through scenarios where they might not have thought was a time they needed to wash their hands before. So we've improved communication among staff regarding hand hygiene. We provided a means of reassuring our patients that hand hygiene is a priority to us, It's also a visual cue to engage them in the process as well. And we've engaged staff with raffle drawings and rewards for adapting to this new system. We've tried to make it really fun for them too. Another exciting finding is we did decrease our hospital-acquired C. diff. Now, it is part of a multidisciplinary collaboration. It wasn't just BioVigil alone. It was BioVigil with pharmacy, microbiology, nursing, and infection prevention. We all really focused on this. One of the tools that helped us is BioVigil can set a room to only accept hand washing at a sink with soap and water. So we would turn on the room with the BioVigil remote to contact plus mode, and that made it a little more emphasis that you can't just use hand sanitizer on your way out of this room. So together, the awareness, the diagnostic stewardship, and education, we decreased our C. diff. And one more unexpected result is we decreased our employee absenteeism quite significantly too. We looked at a period of about 6 months and found a 22% reduction. And then 10 months later, there's another sustained reduction too. So we factored in, was it manager or staff turnover? Nope, everything there was consistent. Patients had pretty much the same levels of acuity. There were no community events, such as an exceptionally severe flu season. So it naturally leads us to the fact that the person performing the hand hygiene reaps the benefits too. All right, so this naturally leads us to our next steps. So we are going to emphasize patient hand hygiene. We got our room service associates from the dietary department to add a little blurb on their script about hand washing. We have these little towelettes on the tray to help them wash their hands. We are supplying hand hygiene products. We're going to get these wipes for them. And menu signage, we're going to put a little message inside the lunch menu itself, reminding them to perform hand hygiene before eating. And there's going to be a sign campaign throughout the hospital. So this isn't just for patients, it's also going to be for visitors. We have implemented a new visitor management system with security, so everyone comes in through a single location and gets their ID checked and the badge sticker. So we're going to use that as a point to emphasize hand hygiene for visitors as well. Here's an example of the sign we came up with, and the slogan, protect patients and protect yourself. So in conclusion, it's really the people that prevent infections. BioVigil has given us a tool to remind staff of hand hygiene opportunities, to empower people to speak up about hand hygiene, data-driven coaching, and evidence for RCAs. So HAI prevention is really a bundled approach. So one of our tips is to recruit all your Lean Six black belts for implementation. So this takes a lot of planning and coordinating. But BioVigil treated us really well. They were a very big help throughout this whole procedure, and they were there for us every step of the way. So you won't be alone in implementing this.
Dayle, thank you so much for that very thorough presentation on your patient safety initiative. I'd now like to encourage everyone on the phone to ask any questions that they may have. We do have a couple that have come in, and one of those was, as your title was focused on patient safety, was there something going on at UHS that really led you down this path to have focus groups after direct observation? Was there a series of events or one event, or was it just something that was a natural path that you followed?
That's a good question. I don't believe there were any such like sentinel events. It's hard to think about that right now. I don't believe so.
Okay.
It was part of our journey to a high reliability organization.
Okay, that's great. Another question we have from one of our participants is, have you received much patient feedback after implementing BioVigil?
That's a good question. We expected to get a lot more feedback in our paper surveys. There was a few comments. One person said they liked our hand washing machine, so we thought that meant the BioVigil badge. There are some comments they get in conversation, but really I think patients kind of expect us to think of hand washing as a priority. They're not making as big of a fuss over it. It's the basic service that we're providing with our hand washing.
Okay. What re-education communication tools have you used with your staff to enhance compliance with hand hygiene,
Let's see, re-education materials. Yes, this is a constant education thing. So we demo the badge on orientation. We talk a lot about hand hygiene opportunities. We send out a weekly tip of the week, and it always comes down to hand hygiene as being one of the most important steps for anything.
You had mentioned in your slide that BioVigil captured over 1 million hand hygiene opportunities a month. Are you serious? I'm just reading verbatim what this question is.
Yes.
Are these numbers accurate?
Yes, they are accurate. It counts every time the badge wearer enters and exits a room. So those are opportunities. I mean, there are only 2 of the 5 World Health Organization opportunities, but with the size of our facilities and how busy we are, over 1 million.
Okay, and I have another one. Can a staff member see the color on their own badge, or must someone else see it to tell them? And there's another part. If the badge is located below the chin on a collar or jacket, I don't see how an employee can visualize it. Yeah. Oh,
yes. Yep. Wearing the badge, you can see it. Usually people wear it on the collarbone area, like a chest pocket. You can see the light. And if it was to be red, it would give you a little buzz beforehand too, after a period of however many seconds your facility decides to set.
Okay. And then another one, was there any IT involvement with wiring your ceiling? And if
there was a lot of IT involvement. Now the ceilings don't need to be wired. The beacons are held up by magnets and they're battery powered. But the base stations where the badges get charged, they did need some special attention from our IS department.
Okay. And do you think getting the physicians involved early on or having them use it first would encourage better involvement?
Yes. Our hindsight is 20/20, and it really takes dedicated physician involvement from the beginning. So once they get away with not doing it once, then it's a little harder to get them involved later on.
Okay.
So we're not through yet.
Okay. Give me just a moment. I'm just reading through the QA to make sure we covered everything.
One of the questions we often get is privacy. Staff are often concerned that it's tracking them, that if they accidentally wear it home, that it's going to follow them. And so that we say, nope, there's no GPS in there. We're not tracking them. We can't see that information at all. It's not collecting any other biometrics other than whether or not you entered and exited a room and if you washed your hands or not.
Okay. We also have a question on the chat about onboarding physicians. How was this done?
Yes, onboarding physicians. We've presented it to them at orientation for the new ones. There's some very detailed handouts and a YouTube video that they can access as well.
And I think that there's another part of this on the QA. Do you have your physicians wear it?
Some of them do, not as many as we originally hoped for.
Can you elaborate on that a little bit, Dayle?
Yes, some of our hospital physicians wear them. Actually, it's our emergency department physicians who wear them the most. And they do pretty well with them down in the emergency department there. You would expect them to have a little more trouble due to the nature of the environment, but we say if the emergency department physicians can manage to do it and have high rates, then anybody can do it anywhere.
Right, and I will just piggyback on that for our listeners. That we've definitely had some challenges in some of the facilities of our customers, but I think it's a matter of time before the physicians themselves have a red-faced moment where the patient has seen other medical providers wearing the badge, and then the physician will come in without a badge on, and the patient will say, "Where's your badge?" And so then I think that's the point of inspiration for them to also show that they care about their patient safety, and they care about this validation, and so they also start wearing the badge.
Yeah, that's a very good point.
Okay. It looks like we have taken care of all of the questions online, and I don't see any other ones on the QA. So Dayle, we want to thank you again for sharing your journey with us and with the listeners. This session has been recorded and will be available on our website. And we look forward to hosting you for the next BioVigil webinar. Thank you so much to everybody for joining. Have a great afternoon.
Thank you.